Hello, I'm Sue. I'm a cancer patient and I co-chair Voice, the St George's Cancer Patient Group. We work closely with the cancer teams to offer you a series of videos to support you when living with and beyond cancer. We aim to help you better understand your care, know what to expect before, during and after treatment, what you can do to look after yourself, and how to find the right support for you and your loved ones.
This video aims to support you when having systemic anti-cancer treatments, often referred to as SACT for short. It is your consultant who orders your treatment with our pharmacy, where it will be prepared on demand. All prescriptions are individually prepared following instructions from your clinician and made on the day of treatment. On each visit to the day unit, the nursing team will complete a few tests to decide if you are fit enough to have the treatment. They will also measure your vital signs, including your blood pressure and temperature. For certain treatments, additional tests may be required, such as urine tests or ECG. The nursing team will let you know if this is required for you. The team won't be able to pick up your treatment at a pharmacy until they know your test results are satisfactory. So you may experience delays in starting treatment. A member of the team will counsel you on any medications you need to take home as part of your treatment plan. If you have any questions, please inform the nurses and they can discuss with the SACT specialist pharmacist. Some SACT treatments require you to receive supportive medication in the form of an injection under the skin to help improve your immune system. If able, we encourage our patients to complete this themselves at home, as it is a simple and easy injection. If this is part of your treatment regimen, you will be provided with training and equipment.
Hi, I'm Dal Domingo and I'm the lead nurse for the Acute Oncology Service. With treatments specifically designed for you, the side effects will also be individual. Side effects of treatment will depend on the types of drugs you are having. Different drugs cause different side effects. Your doctor and nurse specialist will explain the side effects your treatment is likely to cause. You may get some of them, but you are very unlikely to get all of them. It is very important that you tell your team which side effects you are experiencing so they can help. Ask your nurse about the cancer research diary to help you keep track. Some side effects are mild and easily managed with prescribed drugs to take before and or after treatment. Other side effects can be harder to manage but can often be reduced or helped in some way. Often, the main areas that are affected are where new cells are being quickly made and replaced. Here are some of the main side effects that you may experience and what can be done to help. Your white blood cells count may be reduced, and as a result, you may be prone to infections, which could delay treatment. Taking your temperature regularly will help monitor how you are and advise if you need antibiotics. With your immune system being very challenged by your treatment, risk of serious infection, sepsis, will increase. You may feel very anxious at the word sepsis, but the importance is to be vigilant with your symptoms. Do not wait to report any signs of infections, like changes in temperature, urine, or skin. Make sure you and your loved ones have your AOS hotline cards. You'll know it as the yellow card, and call us if you feel you need to. Your red blood cells count will also likely be reduced, and you may become more tired or feel like you have no energy. Do not hesitate to call your nurse specialist or consultant for a prescription and advice on how to manage fatigue. The team will advise you if your treatment may affect your hair, as you may lose it or it may become thinner. At St. George's, we can offer access to a wig specialist ahead of losing your hair, and the Macmillan Center team can help you find a trained hairdresser, headscarf tying workshops, and access advice for hair, skin, and nail care. Mouth problems may happen in different forms like soreness, ulcers, and taste change. Taking care of your mouth is really important, but can be difficult when sore. But try to keep a daily routine with gentle cleaning and flossing your teeth. Keeping your mouth moist is key, so drink plenty of water throughout the day. Gravies and sauces added to your food can help, also if swallowing is difficult. You may experience a change in your sense of taste. This may be due to the cancer, or it can be a temporary change following cancer treatment. Experimenting with flavoring like seasoning, marinating your food may help you enjoy your food better. Your stomach and bowel can be affected in different ways. Depending on the type of treatment you are having, you may feel sick or be sick. Usually you will be given anti-sickness drugs before and after treatment, as it can be easier to prevent than treat. Other symptoms may be constipation, diarrhea, and loss of appetite. In all cases, keeping hydrated is important alongside managing to eat well in between treatments. If it becomes too challenging, do call your clinical team. Steroids are sometimes given alongside your treatment and may cause some unsettling side effects like indigestion, increased appetite, feeling more energetic or restless, or having difficulty sleeping. The treatment will often be given for a short period of time, and afterwards you may feel tired and a bit low in mood and have aches and pains. It may take 2 or 3 days to get better. Side effects like tiredness or feeling sick or weak can reduce your sex drive and make having sex difficult. It can help to talk through any concerns about your sex life with your doctor and nurse. It is also important to try to talk about how you feel with your partner. Cuddling, touching, and stroking are good ways of showing your feelings if you do not feel like having sex. If you have sex in the first few days after having chemotherapy, you need to use protection. This is to protect your partner in case there are any chemotherapy drugs in semen or vaginal fluid. But remember, cancer cannot be passed to your partner, and sex will not make the cancer worse. Any problems with concentration or memory, sometimes referred to as chemo brain, are usually temporary and mild. But while they last, they can be frustrating and interfere with your normal activities. They may delay some people from going back to work, school, or to social events. Keeping a record of your symptoms may help you work out if certain things make your memory worse. For example, you may notice that symptoms seem worse first thing in the morning or when you are tired or hungry. This can help you to plan your day so that you do more difficult tasks when you feel at your best. While many of the side effects we discussed can be simply managed by yourself or with some drugs, at times they might become worse. So if you are experiencing these symptoms, the Acute Oncology Service is available 24/7 for advice and support. Our website will help you check your symptoms and advise whether to call your GP, your cancer nurse, our oncology service, or A&E. There are a number of things you can do to help yourself. Your doctor and cancer nurse can give you more information and support.
My name is James, and like you, I am a cancer patient at St. George's. In 2021, I had chemotherapy and surgery for bowel cancer. So I understand it is a lot to take in, and it is all quite confusing. But believe me, you are in great hands. They are experts. While the staff may look like they are always very busy, they will make the time to listen to you. What I have learnt is that communication is the key. No question is a stupid question. Your team are there to answer your questions and explain again if you didn't understand. For this video, here are the key messages to take away.